today I'm conducting a static postural assessment. Okay, so we're going to use a plumb line, as you can see for this, and this will allow me to assess different landmarks on your body and assess whether there's any postural deviations that are considered to be outside the norm. So throughout that, because I'm doing different perspectives, I will have to get just to move around a little bit. Okay. So firstly we're doing the anterior assessment, which is front on. So if you could just perhaps shuffle slightly to your left. That's good. Okay. Now hands down by your side, just sort of relax a little, loosen up and don't think anything in particular about your posture. Okay, now from this perspective I can see straight away that your right shoulder is slightly elevated. Okay, so I'll be marking that on these diagrams here, as you can see, with the different perspectives. Okay. Okay, and making associated notes with that. So yeah, definitely your right shoulder is slightly elevated. Coming down through your hips, that looks fairly normal, as do the knees and ankles, so that's quite good. Okay, now I'll ask you to turn to your right, if you could. Thank you, and this will be a lateral assessment. Okay, just head up, that's right, just relax. Yep, that's looking pretty good. Everything appears fairly neutral. Okay, and if you can do another 180 and face the opposite wall. Sorry. That's okay, thank you. Just shuffle slightly forward. I just need to get that plumb line just in more in line with your ear. Yep, again that's looking pretty good. Shoulders, hips, knees and ankles. Lovely. Okay, now I'll get you just to have your back to me if you can. Thank you. And just slight shuffle to your left. Would be good. Yep, and again I can see that your right shoulder is slightly elevated, which obviously confirms the anterior perspective as well. Again, the hips are okay, as are the knees and ankles. Okay, alright, so with that, thank you, it's basically showing me that your right shoulder, as we said, is slightly elevated. That would probably mean that your upper scapula and upper trapezius are overactive, so you're obviously favouring one side over the other. Okay. So obviously that's an area that in your program we would have to work on stretching. Okay. And as far as strengthening goes, probably the lower trapezius through here requires stretching. So probably an exercise more like a seated row would aid in that. So both those exercises and stretching I think you'd incorporate into your program. Based on that, everything else looks pretty good. So you certainly don't need a referral to a health professional. But certainly if you started experiencing any pain in this region throughout any of the exercises or stretching, then we have to refer you. Okay? Okay. Thank you.